Hi Fraser, thanks for joining us. So, based on what you've heard tonight, what's the one thing that you think you can do to maximise the opportunity for your pharmacies?
As a regional manager, I think that the most important thing I can do is talk to my people, inspire them, calm them down, make them understand the journey we're on, and help them understand the opportunities going forward and be excited by it.
Thanks for joining us. If there was one thing that you could do walking out the door tonight, what would it be?
Well, I really feel that as a pharmacist, I am motivated to really get involved. So I've definitely put my name down to join the LPC.
No, I think the main thing is I'm going to go straight back tomorrow morning and try and get in contact with my GP practice. Got a good relationship with us at the moment, but trying to improve that and get sort of, as you said, the pharmacies involved around me involved as well.
It's that degree of change that's there and a determination that the change is going to happen this time, I suppose, isn't it? Where before change has been mooted and there's been opportunities there, it doesn't seem to have been will at the higher levels to sort of deliver it, but there does seem to be that determination from NHS higher up to make things work differently in the future.
It's together.
Well, I think the really good thing for me out of the whole thing was when we actually started talking around the tables and people there recognised how important it was to have a different view about how they're going to communicate and actually work with the GPs to get a common understanding and work locally amongst a group of them to actually think about how they make it easier as a group of community pharmacies to move forward into the future. I thought it was really positive, some really good attitude and also some real positive thoughts about what they do next around the communication lines, around how they can use pharmacy voice as an engagement link. So there was some really positive vibes about people not only recognising the need for change, but what they might do as those first steps on that change process.
I'm just looking for new opportunities. I already work closely with my GP practice. I'm a practice pharmacist as well as being a community pharmacist. And it's about taking it to the next level, looking at maybe opportunities for IP, maybe looking at bigger, sort of working with bigger practice groups, maybe they're looking at joining together. Maybe we should be looking at joining together with other pharmacies so that we can work together within the GP cluster as a pharmacy cluster at the same time, so that we're sharing expertise, we're sharing knowledge and working forward as a team rather than as silos as we talked about today.
Really good point. Thanks, Gareth.
So I think one of the things that could be done differently is there still seems to be some perception around resistance of general practice, and I think in order to start a new relationship we need to probably forget the old relationships that were there, and we need to actually draw a line in the sand and think about the new world and how we move forward and not dwell on, well, we've tried that before and it didn't work, or we tried to have a conversation and it didn't work. So for me, let's forget the gone before and think about how we channel our resource into the future.
Fantastic.